Jones-Timoney from the University of Kentucky, and today I am here with the Dean of the College of Public Health, Dr. Donna Arnett. Thank you so much for showing us around today.
I'm thrilled to be able to show you.
So we're starting off in your office, and we're going to head outside and walk through the college as you tell me a little bit about why you're so passionate about public health.
Well, I discovered this field called epidemiology, which is the study of epidemics and populations. And I had been doing clinical research. And when I found out about epidemiology, it's really all about how do you design the right studies to answer important questions. The light bulbs went off and it was like, this is what I was meant to do. So I discovered epidemiology and public health actually in a backdoor kind of way.
Well, how did all of that lead you to Kentucky?
Well, interestingly, I was born in Laurel County. My family has been in the Bell County region since the late 1700s. So it's because of that that has kept me coming back to Kentucky.
And so what attracted you to some of the, I guess, broader goals of the University of Kentucky? I know that public health is really important here.
So one of the reasons I chose Kentucky as a dean's position is because there's so many public health issues and crises here in the state. And it really is almost like a natural laboratory for studying and for helping us to understand why we're so unhealthy in so many different areas. It's from opioid addiction and overdose deaths to cardiovascular disease and cancer. You know, we're really at the bottom of many of these health indices. So I wanted to come to see if we could make a difference.
I know that a lot of students are choosing the UK College of Public Health now, which means there's been a lot of growth.
Well, we have had the fastest growing undergraduate program at UK. And I think the reason public health is so popular is that it's a broad field that encompasses very basic science in the form of toxicology and genetics, mathematics and statistics, to things like health policy and how do we create the right financial structures to support health systems in the country. And then we have all this that we do in communities with managing community health and health behavior. So it's a broad field, and the kids now really want to make a difference, and this is a field where you really do make a difference.
Well, we've made our way outside of your building and we're in front of Scoville Hall for a very important reason. Can you tell us a little bit about that?
So recently the Board of Trustees approved Scoville Hall as the new academic home for the College of Public Health, and we are unbelievably excited about that. We've never had our own building. We've been existing in many different buildings on campus. And so this is going to bring us all under one roof for the very first times, where we have classrooms with our students and our faculty all together in one space.
And you'll be so close to the medical campus and then also the research that's going on.
So you know what's really interesting about public health, I told you we're a broad discipline, and many of our colleagues work in sociology, psychology, statistics, but we also work with medicine. And so being in Scoville Hall, we're literally bridging both sides of campus.
Well, thank you so much for giving us that news. And now we're going to talk a little bit more about research, and to do that, we're going to head over to the Healthy Kentucky Research Building.
Great.
We've made our way to the Healthy Kentucky Research Building, which is a beautiful new facility. And I know that a lot of the researchers here are actually from your college. Tell us a little bit about their work.
They are. We are part of that $87 million grant, the largest grant in the UK's history, for opioid use disorder and improving the rate of death by 40% from opioid overdoses in the next 3 years. That's a lofty goal. So our researchers are managing the data and data statistics part of that project. We're also working in the community in terms of engaging our local communities in this partnership. So we have 4 faculty here from the college involved in this center.
Tell me a little bit about why this research is so important to the state that the university serves, Kentucky.
So much of the work has been conducted around data from the Kentucky Injury Prevention Research Center. And they're a bona fide agent of the state of Kentucky, which means that we're able to apply for grants that the state of Kentucky would be applying to from the CDC. And so what we are so good at is quantifying the number of addiction overdoses. We quantify also what are the substances on board when people overdose by linking different data systems like the toxicology records with the coroner's reports. And so we were actually one of the first in the country to do that kind of intensive surveillance so that we really have a much more granular look at the opioid epidemic and specifically the substances that are killing people.
What other types of research is going on throughout the college beyond opioid use disorder and substance use disorder that you're really excited about?
So one of the areas we're really strong in at UK is in the area of cancer screening and prevention. So what's fascinating is we've been able, through not only our work but with the Medicaid expansion, to reduce the rates of colon cancer mortality. One of the biggest killers, we're actually ranked 50th out of 50 states in colon cancer mortality. We've actually shifted that curve of mortality downward by 25% since we implemented this FIT test screening coupled with colonoscopy. So we're very proud of that work. We do great work also in the area of statistical genetics and genomics, and that's a mouthful, but really understanding how our genome is contributing to common diseases like heart disease. And then finally, we do a lot across the colleges at UK in agricultural injury prevention. We have a center called SCAHIP, the Southeast Center for Agricultural Injury Prevention. That's a mouthful, but they've been very instrumental in finding ways to protect farmers from things like silo deaths and tractor rollovers.
It seems like, especially in your college, partnerships are really important.
Absolutely.
Do you find a collaborative working environment here at UK?
Yes, it's really been seamless to find collaborators. You know, I believe in my research has always been across many disciplines, bringing people together to try to solve complex problems. And it really takes those different perspectives and that interdisciplinary approach to get at some of the what I call wicked problems.
Well, any last things that you want the rest of campus to know about your college?
You know, students who come into public health want to save the world, and that's what we're all about. We are passionate about helping people and helping communities, and we want to be the catalyst for positive change in population health. And that's who we are. That's the fabric of our DNA as a college.
Well, thank you so much for taking the time to show us around today. It's been so interesting to see how passionate everyone is in the College of Public Health and the great work that you're doing around the state.
Thank you.
If you'd like more information about the College of Public Health, just click on the website on the screen.